Welcome to USMLESarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Right. Good morning, good afternoon, good evening, everyone. And thank you for joining us. I know it's the holiday season, so thank you all for taking time out. As we kick off the new season, this webinar we wanted to do because we received a lot of questions on students starting the next season. So about US clinical experience, about letters of recommendation, and of course about research. So what we'll have today is our speakers, Dr. Weissman, and some of our other preceptors who help our students with rotations and research. And then we will also have students who have gone through the rotations, and they will share their tips. They will share their guidance on how to make the best use of the rotations in the upcoming season, and obviously how to get great LOR. So that will be the focus for today. You can ask questions in the chat. I will be there. It can go up to about 2 hours, so we'll take breaks and I'll keep answering questions in that. And of course, we did receive a lot of questions anyway, so we'll go over that as well. And there'll be some very attractive discounts, and there are a few other offers. So for those of you who are interested, stay till the end, and we'll go from there. But without further ado, let's get started. Our first speaker, Dr. Weissman, who is actually at Hackensack Meridian. He's the director of clinical research as well, and he helps our students both with research and with rotations. So Dr. Weissman, welcome, and over to you. So as you kick off, maybe talk a bit about yourself, and then the main theme on how can students secure strong rotations. What do PD look for in LORs? You are in the admissions committee, so what do they look for when they look for a strong LOR? And how does this LOR play a role in the application? And more importantly, I think we want to understand if telerotations are still worth it. Do those LORs hold value? How should I plan telerotations if I'm not getting the visa? So 3 or 4 questions for you.
Sure. So first of all, I'll start off by thanking Chauhan and USMLESarthi. They've been a good partner of ours, really helping us provide rotations, research, and really helping a lot of students over the years. Just introduce myself real quickly. Simcha Weissman, Dr. Weissman. I'm from New Jersey. I work at a couple of the hospitals in New Jersey. I round with some of the residents. In the hospitals, I work very closely with students in a couple different areas. I lecture for virtual telerotations. We go over very, very interesting hospital cases that I've seen over the past couple of years, and that are very good teaching points. I do a lot of research with students, both locally and internationally. Students from all over, India, Pakistan, Syria. Trying to think where else, Dubai, and many other countries. I really enjoy working closely with students. I hope it benefits everybody, and over the years it has been very, very beneficial from the feedback that I've gotten and we've gotten collectively. So that's a little bit about myself. I think I should start off talking about just letters of recommendation in general, right? So when interview committees for different residency programs, regardless of the specialty, are reviewing your application, they see a lot of things in front of them, right? They see numbers. They see, number one is they see a pass-fail on USMLE step 1. They see a pass-fail. Obviously, they're likely going to be looking at a pass, because if they're looking at a fail, that's a different story. They're looking at a pass on step 1, right? So I would take a second and try to put yourself in their head, right? They have, let's say on their desk, 1,000 applicants. They have more, but let's just say 1,000. They usually have 4,000 to 6,000. Let's say they have 1,000 pieces of paper on their desk. Now, everybody has a pass for step 1. Okay. Step 2, they have a number, 228, 232, 236, whatever the number is, they have a number. Now, they have to say to themselves, which students do I want to invite to my program for an interview, right? So numbers are numbers, right? They want to look for things. They want to look for things. Now, one of the things they like to look at is experiences, right? They look through experiences. Oh, I volunteered here. I did a research here. I did this, but also letters, because letters of recommendation help give the program directors and the faculty good, valuable information about the student. What kind of effort did they show, right? How did they work on a team? Were they good team players? So kind of gets me back to letters in general are a very good way to have a professor, right, or a preceptor or an attending vouch for you, vouch for the student. Now, I would also mention that not all letters are the same value, right? Not all letters are the same value.
Dr. Weissman, you got muted. Okay.
Oh, sorry. Not all letters hold the same value for different reasons. Number one, right? If a letter is from a community doctor who's not affiliated with any hospitals, it's not going to hold as much weight as a doctor who's affiliated with hospitals, who works with residents, who could attest to your education on a much higher level, right? And then the quality of the letter. What are they saying? Are they saying things like this? I worked with a student. He was very smart. He was very smart. I think you'd make a good resident, right? It's not such a strong letter, right? You want to say things along the lines of the student was a team player, right? They communicated well with my staff. They didn't cause any issues. They were very punctual. Anytime they had a difficult patient or case that we talked about on the Zoom, they went up and they read on it. Again, do you want to show certain things here? Team player, effort. And the reason I mention effort and how much they were interested in the field that they're applying to is because that takes me to my second point, which is talking about telerotations. Now, people say, oh, what's the point of doing a virtual rotation? The answer is it shows the same sort of thing. It shows effort. How much were they interested in trying to obtain a letter from a U.S. physician? How hard did they work at it? And if somebody's writing a letter and says, oh, a lot of times they're not going to say exactly, I did this lecture on Zoom. It was this day, this time. It's more like, we spent a month together. We discussed many interesting topics in medicine. And it vouches for your ability to have an interest, get along with everybody on the call, have interest in the field you're applying to, and show effort, and ultimately a letter as a reflection. So I think it's very valuable. I've only heard that it's been valuable. I've never heard anybody say, oh, that didn't matter. It was virtual. I've never heard that. If anything, sometimes it's the same, right? So those are my points. Juan, did I miss anything? I know it was a little bit of a load.
This is excellent. And I think what is important, as you said, is for students to understand that the importance varies by where they do the rotation, with whom they do the rotation. So yeah, that's great. Dr. Weiss, and I do want to tell our students, Dr. Weissman is offering very attractive discounts. He and I discussed. So if you do the rotations till March and also research, so Arti, maybe you can post the link for Dr. Weissman's rotation and research. So for those of you who are interested, get in touch, because there are very, very attractive discounts, more than $400, I think, on the rotations if you want to do till March, and as well as research. So Dr. Weissman, maybe also talk a bit about day in the life of your rotation. What does a student end up doing in your rotation?
Yeah. So one thing I remember I never talked about was the research yet. We can get to that in a little bit.
Yeah, we'll get to research.
We'll get to research. So I'll just kind of focus on rotation. So, I think students who join the virtual experience really benefit from the fact that it's comfortable. It doesn't involve any travel, any visa, any housing. And we do it. It's 3 days a week. It's usually in the mornings. It's 3 days a week on Zoom, and we do a few things. So number one is I do it with another doctor. So we do it together, and you can get 2 letters recommendation from that. So it's very good. You can get 2 letters. It's virtual in the sense that it's on Zoom, but I share my screen and I walk through, obviously without showing any patient name or anything like that, to be totally HIPAA compliant. I go through different cases from the hospital, interesting cases, teaching cases. And I go through from the beginning when they come in, to their history, to their physical exam, what's important in their physical, how to make an assessment, how to make the diagnoses, what's the right management. And then I build on that to a very high level, kind of where the residents are, second year, third year residents, teaching points, things to pitfalls that residents make, how to avoid those pitfalls, where to troubleshoot issues, what happens if this was high, what happens if this was low, what to do in this if they have an allergy to this medication. On a very high level, we start off very basic and we build throughout the end of the hour and a half session. Students get a very good handle on the topic at hand. We also do question sessions in which we go through questions that will come up on, not only the steps, but on the residents in-service training exam. So very high level for medicine, internal medicine and family medicine, and walk through some of the very big topics in medicine like heart failure, atrial fibrillation, GI bleed, liver disease, COPD, asthma, and kind of go through and show you how the exam likes to ask questions and build with the education on that. So it's a very multifaceted rotation. It's very well received. And I think it's something that many, many people could benefit from. In person, when students come to Jersey, again, pending feasibility and visa and other issues, but assuming that you're able to come, I think it's also very robust to actually work in person and see how, the day-to-day of a physician, what rounds are like, what good bedside manner is, see some interesting cases, discuss some interesting treatment plans, and get a very good feel for what it's like to be a resident as if you would, when you would start intern year. So I think they're all valuable experiences.
Okay, so Aarti, if you can post or Ashima, Dr. Weissman's on-site rotation link as well as the remote rotation link. I think you posted it only for hosts and panelists, so post it for everyone, please. And again, if you are interested in discounts, Dr. Weissman is offering discounts. So Dr. Weissman, let's switch gears quickly and talk briefly about your research course.
Oh, yes, absolutely. So I would also start off by saying research is another valuable way that you can, as a student, you could show the program director, the associate program director, the core faculty that you are interested not only in being a resident, but you're interested in that field. Like if you're interested in internal medicine, I want to apply to internal medicine. Look, I did research in internal medicine. I did research in cardiology. I did research in oncology. It shows them that your interest is in academia, something that residency programs want to see. It also shows them that you're very hardworking. Number two. Number three, it shows them that you're able to work on a team, because research is always on a team. So it shows them a couple of very valuable traits about you. Number one, interested in the field, right? You're doing research in the field, interested in academia, interested in number B is hardworking, and you are somebody who can work well on a team. With a goal-oriented. I'm trying to publish. I'm not working on a project by taking, patients, whatever, any sort of project you're doing, collecting data, and then you just let the data sit there for 5 years. No, I'm working to publish. Now, the way it works, so again, that's number one, very, very valuable, especially in the era of step one being pass-fail. It's really, really a way to stand out. I've heard this from many program directors myself. I think it's very valuable. The way it works is we work on a topic, usually a large retrospective study, either as a full manuscript to send to a journal or to present at a national, international conference. But regardless of what it is, it's usually a large database study with real data, and we work together, and it's 3 parts to the research month, right? It's a month long. It involves statistics, so we teach a little bit about basic intro to statistics. We teach how to write manuscripts. We discuss methodology, and then we also work, quote unquote, hands-on on the paper, all virtual, all on Zoom, all in the comfort of your home, and we communicate via WhatsApp group chat, and we work on papers. And at the end of the month, within a few days of the end of the month, we try to submit to the journal or to the conference. And then it's whenever we hear back. Sometimes within 2 weeks, I've got it accepted. Sometimes it's been 6 to 8 months. It all varies, but we submit it at the end of the month. And we've been very successful. I would say like 90 to 95% of them have been accepted within 2 to 3 months. 90%. Definitely within 6 months, I would say 95 to 99%. So very successful overall, and it's a good way to showcase your interest in academia and to have an actual publication that goes on your ERAS CV, because in ERAS it says like research publications, and you put the name of the paper, the authors, and the journal you submitted to, or the conference you submitted to. So it goes on your ERAS, and that shows programs that this is a serious applicant. This is somebody who really not only is interested in my program, but is very hardworking, good team player, and is goal-oriented. I'm interested in academia. So I think it's been wonderful. I think students overall have found a lot of benefit from it. I get a lot of thank you emails once, at the end of the cycle when students match. And I hope it helps everyone. And I would love to see anybody we do a different project every month, usually GI or oncology related. But it does vary, sometimes cardio, sometimes pulm. So please be in touch with Sarthi team to know what's available. Yeah.
Well, thank you. Thank you very much, Dr. Weissman. Appreciate your time on this holiday weekend. And again, for those of you interested in Dr. Weissman's and Dr. Atut's on-site rotation, there is more than $400 off, as well as there is a heavy discount in research and in telerotations with them if you enroll till March. So with that, I want to thank you, Dr. Weissman. Appreciate your time, and we'll be in touch.
Very good. All the best, guys. Thanks so much for joining,
Thank you, Dr. Weissman.
and hopefully you'll see some of you around in some sort of capacity in the future. And I look forward to working with everyone. All the best. Enjoy the weekend. Yep.
Thank you. And again, for any questions, you have to post it to everyone, not to only hosts and panelists, so that everyone can see. So just by way of housekeeping, everyone, please. And Aarti or Ashima, post the link to Dr. Weissman's research also, if not done. So for those of you interested, get in touch with us, and there is more than $400 off on the rotations. Very quickly, before I move on, there's a very exciting announcement I do want to make. So let me share my screen and show it to you, because we received a lot of questions on inpatient exclusive rotations at residency programs. So if you go to our website here, and Aarti maybe or Ashima post this link, USMLESarthi.com, Clinika/-rotations. So post the link, please. So if any of you is interested, if you look at it, we now collaborate with top teaching hospitals and in New York, Maryland, and Texas. And you will see a lot of these rotations now, 100% inpatient, internal medicine, emergency medicine, cardiology, orthopedic surgery, neurology, infectious diseases. So they are all in teaching hospitals. Some of them are a mix of inpatient, outpatient. Some of them are 100% inpatient. So for those of you looking for teaching hospital only and looking for very, very strong LORs in different cities, we just started this. This is going to be the first season. We did have in limited capacity till last season, but those of you interested, go to this web page, and then Ashima or others on our team can help you. USMLESarthi.com /Clinika-rotations. So this is our brand name for this inpatient teaching hospital rotations. If you have any questions, of course, put it in the chat and we'll be happy to answer. So Aarti has posted the link. Go and check it out, and then we can move on. So let's move on. I want to move on. So Dr. Papuna is here. Let me see if I can give. Okay, there he is. Welcome, Papuna, and glad you can make it. So I know you did telerotation with Dr. Weissman and Dr. Atut. So why don't you talk about your experience in telerotations and key takeaway from those experiences, and of course, tips for students who are going into the match in the next season about rotations. But before you start, why don't you introduce a bit about yourself, where you are in your match journey as well?
Hello, everyone. Thank you, Mr. Karatu, for inviting me to this webinar, and I'm thrilled to be here today. I'm an international medical graduate from Georgia, Tbilisi. I'm currently a resident doctor in internal medicine in Tbilisi Medical University, and invited lecturer at the European University and Georgian American University. And I'm also participating in this match season.
Okay. And why don't you talk about your telerotation experience?
Yes. So I did my rotations with Dr. Weissman and Dr. Etude, and these experiences were a game changer in my whole medical journey, and not only for the US residency. So it wasn't just ticking a box on my CV. It was a transformative in terms of honing clinical skills, clinical reasoning, and the experience overall I had with these physicians. First of all, we covered almost all topics, of common illnesses like bread and butter cases of internal medicine, and like common illnesses like diabetes to like the acute ketoacidosis, and we learned not only what to do but why each step is important in the whole process. So it was a didactics in nature, an interactive group-based learning process, and overall, I'm thankful for Dr. Weissman and Dr. Atut, not only because I learned a lot during rotations, but also the mentorship. They dedicated the whole hours for US application, question national citizens, and if I had to sum up what I gained in these rotations, I'd say the clinical reasoning that I gained with this critical thinking, and I was fully involved in this process, right? So in interaction with the physician directly, and interaction with the peers too. So please don't underestimate this group-based learning during telerotations. And personal advice I want to give for future applicants would be to ask questions. Never underestimate this seeking guidance, and I try to be interactive, not just appear, but be involved in this whole process. Especially, I'm talking about specifically on the telerotations, where you can really be involved in this process. And I liked the fact that I could ask questions before, during, and after decisions, right? So it was a whole picture. This was a whole process. This was transformative, as I've already told you.
Okay. Any tips for applicants who are starting now their rotations or telerotations for the next season?
Yes, of course. As I told you, the seeking guidance is a key. Please don't underestimate the mentorship throughout this process, because it's a labyrinth where you need to solve all the steps in this process, and start early. That is my second advice for all of you, because the time is important. Doing it rotations, doing on-site rotations, the application details, all this process take time. So again, start early. And also pay attention to close attention to the details, since each small detail may change the whole big picture and the overall application. So you are assessed during the match season, right? You are assessed as a whole, and then this is a holistic approach. Your rotations, your clinical experience, your research experience, like Dr. Weissman told us. So I try to be interactive, try to be active throughout this season and prior.
Yeah. Well, thank you. Thank you, Papuna. Appreciate your time, and good luck in your math journey. Thank you.
Thanks. Thanks a lot, Mr. Kerr.
Thank you. All right, let's move on. And our next speaker is Mayank Kamani. So, Mayank, welcome. Why don't you introduce yourself, and then we can start the discussion.
Hello everyone. Very good morning. My name is Mayank. I'm an international medical graduate from Tbilisi, Georgia. I did passed my medical school back in March 2023. And after that, I have done around 8 months of clinical rotations in the US, both in inpatient and outpatient care. And this season, I have applied for family medicine and going through interview season. Very excited to be here.
Okay. So, Mayank, why don't you talk about, how early should you request an LOR? Is LOR a guarantee? Can you suggest specific points in the LOR? So basically, what all steps to take to get an excellent LOR?
Sure. So basically, the residency application being reviewed by all the programs at the end of September last week. So typically, we try to get all the LORs in the August because it's a very crucial time to request for LOR from the preceptor we have done with the rotations. And usually we submit 3 LORs from each specialty. So students do try to rotate, before August, at least 2 to 3 rotations, and that's how we can, request for an LOR from August beginning, so that we can timely submit the LOR and process. Because most of the time, ECFMC takes around 5 business days to process the LOR. So if we have LOR before September starts, we can timely process all the LORs in a timely manner, as well as assign all the LORs to different programs. Many times applicants assign LORs to more than one specialty. So it's very essential to have all the LOR processed in a time way before September starts, so we can focus on different aspects of application, whether it is personal statement or ERAS application. So beginning early and completing most of the clinical rotations in May, June, July would be an ideal time to complete the rotations, and August would be the time to request for an LOR, and we can get LORs in September.
Okay. Then, the other thing, of course, is LOR a guarantee?
So most of the time it's not mentioned as a guaranteed, but we as a student have some responsibilities, as well as kind of professionalism which we have to show throughout this clinical rotation. And based on our performance and other evaluation, we can request an LOR, because when we try to have a conversation with the preceptor or the clinical coordinator before the start of rotation, we have been asked certain questions, like what are the specialties we are going to apply and what we are looking for from this particular rotation. And based on that particular evaluation and performance of this 4-week rotation, we can always request an LOR from the preceptor, and that's how we can get a guaranteed LOR from each rotation.
Okay. Finally, any tips to the students on how can they suggest specific points in terms of what they did in the LOR? How can they contribute to making the LOR strong?
So whenever preceptor want to write an LOR, they always have a conversation which specialty we are going to apply, and at that time we can divide each LOR. I mean, if we have done 3 to 4 rotations, we can highlight specific things from each rotation. In some rotation, you would find teamwork experience, having taking care of patients from diverse background, or some rotation offer good procedure skills. So try to narrow down specific things which you have learned from each rotation, make that point stand out through that particular LOR, and discuss about the experiences you have, whether it is interesting cases you presented, you participated in some didactic sessions, what kinds of investigation or the procedural skills you learn from. And many rotations do offer some volunteer opportunities, where you go out in the community, have some experience in giving back to the community. So all those points make a huge difference when we try to show it through LOR in the ERAS application. So list out the things which you learn from each rotation and try to highlight whenever you have a discussion with the preceptor. And that's thing, along with your clinical skills and knowledge, you can highlight your personalities as well as some of the contribution you did throughout this rotation.
Thank you. Thank you very much, Mayank. I appreciate your time and your tips to the other applicants. So thank you and good luck in your match journey. Thank you. All right, let me stop here. I think we are waiting for one speaker at this point, but meanwhile, if there are any questions, I am happy to take. So post it in the chat group. Any questions about rotations or research, anything at all as you get started for the next season. So put it in the chat and I'll be happy to answer. And Aarti has pointed the email or the WhatsApp number also. If you have any questions, you can email us. So I think we are waiting for Dr. Vishal Patel and Sahir Tawfiq. Meanwhile, Aarti, if you can, chase Sahir to see if he's there. Otherwise, we do have Aditi. I think Aditi is our next speaker. So Aditi, if you are around, maybe we can go to you first. Are you there, Aditi?
Yes, I am here.
Okay, let me give you the access to as a host so you can share. So as you get set up, let me answer a question: waived versus non-waived LORs, which one is preferred and why? So you always have to go for waived LORs. Waived LOR means on paper and technically you have waived your right to see the content of the LOR. Never go for non-waived or unwaived LOR. That quality is just not sustainable. Programs don't care about unwaived LOR. It only has to be waived LOR, even if it is from your home country. Okay. All right. Aditi, are you able to share your screen? Okay. Yes, there you are. Thank you.
Yes, sir.
Thank you. So why don't you introduce yourself, talk a bit about where you are in the journey, and then talk about your tips for rotations, how to find, how to apply, how to make most out of these rotations, and opportunities like volunteering and research while they are doing rotations. So some very, very appropriate topics for the students.
Yes, sir. So firstly, my sincere gratitude to all the organizers of the webinar from Sarthi. And I'm really grateful to have this opportunity where I can share my experiences. And I'm Dr. Aditi Karambelkar. I'm an intern doctor from Government Medical College, Baroda. I've cleared step one back then in 2023, and I began my internship. I was applying for rotation simultaneously, and in the middle of the internship, I came here in the US for doing the rotations. I'm currently in Houston, Texas, approaching the end of my rotations in the next 1 week. So, addressing the first question, how to apply for rotations. Being a student from a non-BSLO institute, already the rotations are very less in number because rotations are as similar to the ward postings that we have in the colleges. So it's generally 20 to 30 students per rotation that we have even in our home institutions. Similarly, even in US, we have only 20 to 30, in fact, even lesser than that in the rotations. So being an international student, already the opportunities are really less. On top of that, we also have a categorization of BSLO and non-BSLO institutions. So most of the institutions in India are non-BSLO, except 8 to 10 of them. So my options were already very less. But what I used to do is I used to search all the different hospitals and clinics and university teaching hospitals in different IMG-friendly states like New York, Texas, California, and I used to mail them very randomly. Separate form was made, which I used to mail them. And I also made an Excel sheet of who all have responded, what am I supposed to do ahead, what are prerequisites are required for applications, the application dates. So all this was maintained very properly. I finally got to apply only in 5 of the universities and hospitals. That was University of Florida, UF, then Florida International University, FIU, Kaiser Permanente, Santa Clara, California, UIC, Illinois, Chicago, and in Houston Methodist. So I got accepted in FIU and Houston Methodist. I'd also tried for Mount Sinai, but it did not work out for me. But I also got to rotate at very prestigious hospitals and universities in Texas through USMLESarthi because I had taken the hemat-oncology rotation with Dr. Correa in Houston. And along with him, I got to rotate at UT Health, the Lyndon B. Johnson Hospital, or the LBJ Hospital. And I could also go at Memorial Hermann Hospital. So all these are very prestigious here. And also, I could rotate with the MD Anderson Cancer Center fellows, UT residents. So it was a very wholesome experience for me to get to rotate with all these fellows and residents from such prestigious institutes. Also, along with Dr. Correa, I could attend his private clinic because he had begun it very recently. So we could attend his private clinic, we could go to the hospital. So it is a very mixed kind of an experience. My bedside manners, my soft skills enhanced a lot because I used to observe him very precisely while I was talking to the patients. I could get acquainted to the EMRs because we used to put in some notes, talk to the patients, interview them, get their history. We also attended some telemedicine calls with him. So it was a beautiful experience for me because I could get acquainted to the entire US healthcare system. And that's how I could get into the 3 rotations for 3 months, starting from the month of September to December. And third one was at Houston Methodist. So it's a really amazing hospital. It's a big one. And I have rotated at the hemato-oncology department because that's what I'm looking forward to in fellowship. So both rotations were into hemato-oncology. And even in Houston Methodist, this was a very enriching experience because I could get to learn a lot of newer things like the laser therapy and interviewing with the patients. So because my foundation was very strong with Dr. Correa in the soft skills and the academics part, I could definitely get through the rotation in the Houston Methodist very well.
Yeah.
So
Then, any other tips that you have for the applicants who may be going in for the next season?
actually, I would want to address one little question about how to make most out of the rotation because that's what I experienced myself here. So I, while I was here in Texas, each day while I was in Houston, out of the 2 months, I used to target that I need to do at least one thing which makes me go step ahead than the previous day. So I used to go to each and every doctor in Houston Methodist, check out their emails, try emailing them with my CV, cover letter, personal statement. So in Houston Methodist, I did not leave any opportunity to connect with any of the doctor here so that I could make some connection before going back to India so that I can seek an fellowship ahead. So this was one of the highlight. I also got to learn the infrared therapy administration in Houston Methodist, which was definitely a cherry on the top because that was not something included in my rotation. But because they began with it, I could learn it. I'm also going to be certified for the same. So it's going to be very useful in my CV as well. Talking about Dr. Korea's rotation, it was very good. Apart from academics as well, we got to present certain topics. And I used to be very enthusiastic in delivering presentations, discussing the topic, solving UL simultaneously so that I get an extra edge on attending the rotations. And apart from that, we also used to discuss very multiple topics amongst the fellow batchmates or with Dr. Korea. And apart from that, he also gave us a case report to be done. So this was the highlight of the rotation because he had a case of leukemia cutis with a relapse firstly seen in the skin. So that became the topic of our case report. So research was the highlight of my rotation. And in Houston Methodist, definitely my laser therapy was the highlight. So one thing that I learned and implemented simultaneously during the entire rotation purpose was you have to be on your toes. You have to be a go-getter. So look for opportunities wherever possible, talk to them, try to initiate things, ask your doubts, deliver presentations, discuss topics, also learn things parallelly because we are not here only for rotation, but we are also learning new things. So solve UL, learn the new things, discuss it, put down some notes, get acquainted with the EMR. And that was the highlight. Plus, I would definitely say that apart from all these academic things, I also searched opportunities for volunteering and conferences because in Houston Methodist, there are grand rounds. If anyone is coming to Houston Methodist the next time, so a quick note for them that there are grand rounds at on Thursdays between 8 to 9 a.m. and all the attendings and faculties from different departments, whoever the webinar is associated with, the seminar, are going to be attending it. So all of them are there. So I used to attend them very diligently, talk to the fellows, residents, connect with them, talk to the attendings, go to them, connect with them. So that was a highlight. And second thing that I used to check the websites of the different hospitals here because Texas Medical Center is completely a hub of 3 to 4 medical hospitals and medical schools. So checking the websites of them, signing up for different volunteering events, conferences was a major highlight for me. I did used to go to Houston Food Bank as a non-academic volunteering purpose for just enriching the entire experience as a whole. And one of the major highlight that I can definitely take away was the MD Anderson Cancer Center conference, which I attended on 6th and 7th of December, because it was meant for pancreatobiliary cancers and endoscopic management for them. So very abstract topic. It was meant for free, and I looked into it because I found it through the website, and I really got into it. Through that, I got to learn new things. They were really amazing videos of endoscopic methods that all the experts in the field have been using since a while. And I got to form some really wholesome connections. So basic takeaway that I would say is that I really signed up on the websites and I also searched for Red Cross, but Red Cross did not work because they were wanting us to stay at least for 6 months in the Gulf Coast of Texas to get a proper um, membership in Red Cross. But I searched for a lot of other opportunities of volunteering and conferences as well. So I'm definitely looking forward to something if it works out for me and MD Anderson sometime. So that was a highlight. And all these little things are somewhere I learned from talking to Dr. Korea because he used to talk about different things, not only about academics, but how is life in US? How do you need to study? What all you can do? He also told us about studying stats because that makes you different as a researcher. So he was definitely very, very experienced, very knowledgeable person. So it was a very wholesome experience for me. And that's how I made most out of the rotation because for me, I used to try that each day I have to do at least one new thing that makes me better than the earlier day. So that's what summarizes the rotation.
Well, thank you. Thank you very much, Aditi. Appreciate very, very comprehensive tips, guidance. I think students will appreciate that as well. Good luck in your math journey. Thank you. And
Thank you, sir.
Thank you. Thank you. Let's move on. And I will take questions after our next speaker. So Dr. Vishal Patel has just joined us. Dr. Patel, are you there?
Yes, I am here.
So Dr. Patel helps a lot of our students and, very, very passionate about helping IMGs. Dr. Patel, why don't you give a bit of an introduction and then we'll get into some questions.
Sure. My name is Dr. Patel. I've been practicing in primary care for 25 years. I have private practice, 2 private practices in New Jersey, in Bergen County, New Jersey. I am faculty at the Hackensack Meridian School of Medicine and faculty at Rutgers Medical School for the last 20 years. And I have been teaching since 2000. Having students for clinical rotations in family medicine from Rutgers and recently Hackensack, which opened about 5 years ago. And my practice is very, very open to educating future generation of medical students. And recently I had an opportunity to have a couple of international students, which was a great thing for our office to actually work with the US medical students and gain some insight of how to improve their chances of getting into residency.
Yeah. So, Dr. Patel, let's first talk about when a student comes to your rotation, right? So how do you assess, what do you assess before you give them a strong LOR? Like, what are the components of a strong LOR, in your opinion?
So, as an experienced educator for many years and having seen many, many different kinds of students with different qualities, different backgrounds, different actually working backgrounds, because many of my students, as we know, in current recent years, the average age of a U.S. medical students has gone up to 27. So many of them have actually working experience. But regardless of any background of the students, where they come from, the qualities I look for any students that come in my office is dedication to learning, their motivation to excel, their personality in terms of their interaction with patients, interaction with the staff, and showing me as how they will be working in my office in my place. Basically, any student that comes in my office is a replacement of me for that day, meaning I have them go see the patient right from day one. Because I really want to see their qualities in terms of what their weaknesses are and what their strong points are. And then I can educate them further on improving their weak points. That's the first thing. So I want to see the students coming in with an open mind, not to have any sort of fear, because I am a person that actually like to help the students, make the environment very, very easy to learn in my office. And I think that's the best way of learning, without any fear, just coming in and be open to actually seeing patients right from the day one. And so that is very important to me. And I think that in terms of the other thing is, I'm a very good feedback person. I will give feedback on a daily basis. I don't expect students to actually feel any in a negative way. Any feedback I give to students is actually to improve themselves and make sure that they are in par with the US medical students that are with me. And to be honest, in some of the international students actually are better than the US students. And that really makes me happy to actually see that there are very, very qualified students that come from overseas that actually can, get a residency spot based on what I, see.
Okay.
So these are some of the things that I look for.
Thank you. And I guess the last question we have for you is, a lot of students apply to multiple specialties.
Yeah.
Right. So, and the time for doing US clinical experience is limited. So how should they navigate? So someone doing, let's say, FM, USCE, wanting to apply to IM or vice versa, what are your thoughts on that? How do these kind of letters of recommendation help? If not, what can they do?
I think the main thing here is anybody applying to the internal medicine primary care program as a previous reviewer of a residency program applicants, we really like to see one letter from the IM-FM faculty, because as we know that every specialty has their own way of practicing medicine. And so if you're going to go into an IM or FM, there's a certain way that we approach patients, where we diagnose, in the outcomes we look at. So we would like to have one recommendation letter from the specialty you're applying, particularly the IM-FM. Having said that, any other specialty recommendation letter will definitely add value to the applicants, because we want to see in terms of what the other specialty providers write about you in the letter. Because as a physician, you have to have qualities, more of a core qualities that goes across the board of any specialty you choose. And I believe that, having a letter from another specialty that says more of unique qualities that we look for in an IM-FM residency program definitely adds value. So I would definitely get somebody outside of the IM-FM, but please, if you're gonna get letters, I will recommend at least 3 letters, but one should be in the specialty that you're applying.
Well, thank you, Dr. Patel. Appreciate your time and your tips to the students, and especially that you were able to make it on this holiday weekend. So thank you very much.
Thank you so much. Good luck, everybody.
Thank you. As we move on, I did want to point out, I think one of you asked for telerotation with Dr. Weissman. The link is there. But the exciting news here is Dr. Korea's telerotation you can get for free. It's worth 1,100 or so. So that is being offered for free if you join our platinum program for match. So for those of you interested in going into the match next season, if you join if you join platinum, then you get Dr. Korea's telerotation for free. So Arti, if you can post the link for Dr. Korea's telerotation as well as our platinum plan, I think that will help. So again, there is another telerotation by Dr. Chintav Shah that is also for free if you join the platinum plan. So these are, highly sought after rotations, and we understand many of you cannot travel. So we are making it available for free if you join our platinum match program that is starting. So this rotation comes for free. Dr. Chintav Shah's telerotation is also free. So Arti, maybe post that also. So as long as you join our platinum program now, platinum program for match next season, these two rotations, one of these, you cannot get both of them for free, but one of them are for free. So Arti, let them know about the platinum plan link as well. Okay, so with that, let's move on to our next speaker, which is Ashwini. So Ashwini Bhonsle, I think you're there, right, Ashwini?
Yes, sir, I'm here.
Okay, thank you. I'm gonna give you access to the video, so you should be able to. Yes, we can see you. Thank you for joining, Ashwini. So welcome, and why don't you begin with an introduction about yourself?
Good afternoon, good evening, everyone. My name is Dr. Ashwini. First of all, thank you, sir, and the entire team for having me here to speak. My name is Dr. Ashwini Bhonsle. I am an international medical graduate. I graduated early this year from a medical university in the Caribbean, and I am currently preparing for my licensing exams, that is USMLE. I have done 3 US rotations so far.
Yeah. So, you've done 3 US rotations. So I guess the first question everyone asks is it mandatory to do USCE, as in the LORs from US physicians are, in your opinion, are they mandatory?
So I would not say that they are strictly mandatory. However, they carry a lot of weight when it comes to applying for your residency programs, mainly because it is the US physicians who write the LORs for you. They know how the system works. They know what the program directors are looking for in the LOR. That being said, they would know what to write. And when you go for your USCE from the day one, if you inform the physician that you're looking in for a LOR, they can observe you and evaluate you based on that. So it is very, very important that you have, most programs require 3. So if you have at least 2 US LORs from the US physicians, that would make a lot of difference for your application.
Yeah. And, obviously you've done 3 US clinical experiences, but you'll go into the match probably in September of next year or maybe later. So how do you make sure that the LORs are uploaded on time, or how do you keep a communication channel going with the preceptor?
So if a student is applying for the upcoming one, that is 2025 September, and they've already done their USCE, what they could do is by say like May or June, they could reach out to the preceptor that they already rotated with. They could send them an official email stating that, this was the student, this is the time you did the rotation with them. And you could just remind them that you already did it with them and you're requesting for a letter of recommendation at this point. A lot of times, some physicians might already have given you a LOR. All they have to do is just upload it on the ERAS.
Yeah. And I think that is an important point because a lot of students don't understand how a waived LOR works from a logistics perspective, right? So can you explain a bit on how these LORs get uploaded?
So we all upload our LORs on the ERAS application. So what you need to do is that as an applicant, you cannot upload it. That's one thing that we need to know. It is only the physician who can upload it as well. Once you reach out to the doctor and you tell them that you need the LOR, sorry, there is something where you generate a LOR request form, and you give that form to your physician who needs to upload it, and they will upload it on your ERAS on your behalf.
Yeah. Now, the other common question, which I think Dr. Patel also referred to, relevant LORs for a desired specialty. How important is this, or how are you planning your journey? As in, if you're interested in a specialty, are you looking for doing rotations only in that specialty?
I heard Dr. Patel, as he said, you need at least one LOR from the specialty you are applying for. And I agree with it because every specialty carries its own experience, its own responsibilities. Especially like IM or PEDS, they mainly would focus on patient care, on teamwork, whereas surgery, emergency medicine, they would focus on how the student is able to handle themselves under pressure, how their decision-making capacity is. So it is, my personal opinion, I feel like it is important to have at least 2 LORs for the field that you want to apply to, because that shows your commitment, that you want to go for that field, that your desire for that field. It shows that you already have the experience and the guidance that you need for the field. Moreover, the physician who is writing for you for that particular program, the physician is also a good fit because they also have the experience from that field. So yeah, it's important.
Yeah. Well, thank you very much, Ashwini, for your time. I appreciate it, and your tips are very, very valuable. So yeah, so I think unless I missed anything, any other tips that you have for the students?
I just want to say, with my 3 months of experience in the US, just try to make the most of it. Not all days are going to be the same. In all my 3 months, I had both inpatient and outpatient experience with 3 different physicians, and I would say I really loved my time, especially graduating from Caribbean University, who still have all the medical records on paper and not electronically. It was something extremely new for me. So make sure you make the most of it, get ahead of your day. Talk to your physicians from day one itself, because a lot of times we have very short time. Most of the times we do only 4 weeks of rotation. So the physician needs to get to know you, discuss with them. Even if you're interested in research, you're interested to do a case report with them, let them know from the first week itself so you could work with them according to that.
Yeah. Well, thank you very much, and appreciate your time.
Thank you, everyone. Have a good night.
Bye. Bye. All right, let's move on. So like I mentioned, if you are interested in free telerotations that Dr. Korea and Dr. Chintav Shah are offering, Aarti has posted the link. She can post the link again. And to answer a question, yes, you can pay and also do the telerotations. But if you enroll in Platinum, then these rotations come for free. And by the way, for our Platinum plans, also Platinum, Gold, Bronze, and maybe Aarti, you can post a link. There is a discount at this point. So if you are interested in our match plan, Platinum at this point is $100 off, and there's Gold plan also. So Aarti, if you can post that link so that they can go through the description of the plans as well. I think next what we want to talk about is the discounts on research. So there are 3 research courses that we offer. For those of you interested in research, these courses are very different. So one, of course, is Dr. Weissman's course that you saw, or maybe Aarti, you can post the link for the research, or let me see if I can share the link, or I can screen share. I think that may be useful. So let me share the link. Okay, so we have 3 separate kind of research courses, all of them fairly different in terms of how they approach research. So concept to publication is Dr. Weissman's course, and there, you can do a manuscript, you can do abstracts, conference presentations, and he's offering a discount. Then there is IRR, the innovative research, residency research. This actually comes with a letter of recommendation also. So in addition to manuscript publications, it comes with a letter of recommendation. And then there is a rapid, affordable research. This is actually, as the name suggests, very affordable for those of you who are getting started. So if you go to USMLESarthi.com, even in the homepage, there is research, and then you can click to the 3 research courses: concept to publication, this Dr. Weissman, rapid affordable research, and innovative residency research. So all of them are offering discounts at this time. So go there, and if you have questions, you can email us on these research as well. So that's another thing. At this point, most of the rotations, research, and the match is offering a discount. So let's move on. I think our next speaker is Dr. Yasir Rasheed, who offers rotations here as well. So Dr. Yasir, are you there? Let me see.
Yep.
Okay, let me make you the co-host so that you can share your screen. I think if you introduce yourself, and then we can do the questions.
Sorry, let me just try and give camera access to.
Yeah, looks like your camera has some issues. That's all right. I mean, we can go without the camera. So if you want to get started, that will be fine. Dr. Yasir, you there?
Sorry, am I audible now?
Yes, you're audible. Looks like the camera has some issues, but that's fine. We can. Oh, okay. No, it is there. Okay. All right. So.
Okay, perfect. Yeah.
Yeah.
Sorry for this makeshift arrangement. I was not expecting to be called for an emergency case, but I just had to be there. So just got done with that. I will start by introducing myself. My name is Dr. Yasir Rasheed. Um, I, I think with the U.S. residency system, I've been with it for about 13, 14 years now. Starting with my own journey as a student back in 2013 when I visited US for rotations. And there were three rotations. I did three university rotations. In fact, two university rotations, one community rotation at that time. And then I did the internal match residency match route. But as you can see, I am not an internist. I wanted to be a urologist, so chose a slightly different route. I am a urologist in UK, but we have a consortium where we manage at least four rotations, and some of these are university rotations, and some of these are um, community rotations. I will try to see there's a question in there. Difference between content of these three plans.
Although
I
that's
think
for research.
that's
So
that's for research.
I'll take care of that.
Okay.
Yeah. So
Right. So with the with the US math system, I was given a few questions. I can answer those as well. And but I thought maybe some of those have already been taken care of. So if you want to ask any questions, please go ahead.
So, you can go by your experience, or I guess the question is, do home countries LOR have any value? A lot of students, obviously can get experiences and letters from home country. Do they actually have any value?
Um, They do actually, to summarize it up, but it's very important to understand that, somebody who is looking at your letter, if that PD by any chance is from India or Pakistan or Caribbean or let's say whichever country you are from, he would be a little bit familiar with that system. So they may consider that slightly more. But for somebody who has never stepped out of US healthcare system, it would be very difficult for them to rate you based on that LOR since they don't know the system. The match has really transformed over the years. Nowadays, what they're looking at is, have you actually spent any time in the US healthcare system so that you can acclimatize and really set yourself into the residency easier compared to somebody who has not stepped into US at all. So yes, in a way that not having an LOR at all, compared to that, it's better. And then if you can find some US trained physician who can write that LOR for you, that's better. But nowhere near a US LOR. No, it won't be.
Okay. Then I guess the other question which you can answer is, how do these letters, let's say waived from US, help me stand out in the application process or in this very competitive match process? How do I make sure that the LORs are differentiated and distinct?
I cannot stress on this enough. And the students who come in for doing this rotation, especially the university rotation that we offer at UCSD, I keep telling all of these students that the one thing that puts you aside, it's such a competitive environment. There are thousands of applications. Is when they look at a personalized LOR. It is such an important thing. A generic LOR that any physician would just write to you. It's saved in their computer. They would copy paste it on their on their letterhead, and they will just give it to you. That's still better, but it wouldn't make you stand out. So look for the rotations, look for places which offer you personalized LOR. By that, what I mean is that physicians would talk to you towards the middle of the rotation, that okay, fine, what are your goals, what are your interests, what is that you are doing in research, what is it that you do in your personal life, what is it that made you inspired to be a doctor or to be an internist or to be a gastroenterologist. And then they put all of those things in your LOR. I'll be very open with you. When we manage these LORs, I manage the physicians, or I work with physicians who write about 40 to 50 LORs at least, in one of their rotations every year. And then some of them would go back to you because it's impossible to remember 50 people and their interest and everything. And they would ask you specifically, can you just fill out these 5 questions for me and tell me, what did we talk about? Or they would have something during the rotation that they would work on. Those are the letters that actually stand out. The second thing that matters is that an LOR from a community program, or is that an LOR from an actual hospital program which is offering a residency itself too? So that stands out as well. Were you actually working in a competitive environment? Do you know how residency program works? Or were you just working in a community program where you never had any interaction with the residents itself? So that should also be mentioned directly over there. When I arrange for LORs, I always ask the students, do you remember any particular point from your rotation where you had an interaction with a patient? And that just shows that this is what makes it personalized. So if you are at good terms with a physician, always make sure you do talk to them about it. And for our rotation, we make sure all of these 3 rotations that we always make sure we ask you that what do you exactly want it to be tailored. For example, if you are applying for peds match and emergency medicine match or internal medicine match at the same time, so the letter should be tailored a bit differently. It shouldn't be just a copy paste for both the rotations. It should show your interest towards that particular rotation as well.
Yeah. So why don't you talk a bit about day in the life of the UCSD, telerotation that you offer, because that's a university rotation and a lot of students are interested.
Yeah, we offer a tele as well as a in-person rotation. So both are available now since a few months, about a year now. In COVID, it was completely tele. So what you do is it's a cancer specialty rotation, hem-onc rotation, which counts towards internal medicine match or family medicine match. We have seen people applying for peds as well, but this is mainly internal and family medicine. So what you do is you go in. These are highly specialized patients. We mainly deal in this rotation with thoracic oncology and GI oncology. So mainly thoracic oncology, I would say. So and of course it's hematology as well. So these are different patients ranging from leukemias to lung cancers to other malignancies in the thyroid, metastatic disease and stuff. So there are 2 kinds of patients. Either you are seeing patients who are coming in for the first time, brand new patients. So with these patients, you would get an exposure towards how the initial encounter is done, starting from the history taking and then examination and taking you through each step. And then there are other sorts of patients who are coming in with a follow up for their ongoing chemotherapy, or they are in their post chemotherapy phase. Then there is another clinic where you get to see benign diseases as well, the benign disorders like as anemias, for instance. So it becomes easier at that point. And a lot of students who do these rotations, they make sure that they mention about their benign experiences. It's easier for the PDs as well because they are from different specialties. So something like you, for example, you picked out something about anemia of chronic disease, so you would mention that, oh, this is some interaction that I had. A lot of students are interested to know, do we get to actually interact with patients? We're very clear on that this is actually an observership, but we make sure that as you move towards the rotation on a good day, when we do find that, oh, there's a patient who's fine talking to a student, we leave you with them, we let you talk to them maybe on a counseling part, on a history part. And then this is how LORs are important. I can't stress enough, this small interaction should be presented nicely in your LOR. If you spend a whole month talking to patients every single day and you get a generic LOR, it's of no use. But if you interact once or twice with the patients, but at the end of the day, they give you an LOR which mentions that, okay, fine, I saw this patient, this student talking to the patients, and he was really nice about it. He had kindness, empathy, he had showed a genuine concern and stuff like this. So this is what makes your LOR stand out as compared to a generic LOR. These students also get to do presentation, 1 or 2 in a whole month. Some of our students get to do some publications as well. Especially in HEMONC, you do get a chance to write review articles. I'm not sure if you are familiar with it or not. I'm sure the research courses that USMLESarthi offers, they do talk about the review articles. This is slightly easier because it just involves you sitting at home or in the library and then writing about a particular topic. So you can always write that with the physician as well. So you can talk to the physician that you are able to work on that, and they will write with you. So this is usually how this rotation works.
Yeah. Well, thank you, Dr. Rasheed. Anything else that you want to highlight?
Um, I think over the last 13 years, I've only seen that this match process is getting tougher and tighter with every passing day. Um, I would say that every single thing matters. After the step one scores are eliminated, it's even more important that you stand out on your step two score. I cannot emphasize enough on that. And number two is, of course, you need US experience, which makes you stand out compared to other students. So do not think that, we may or may not. I was listening to another speaker earlier who were like, oh, maybe or maybe not. I would say you would be lucky if you get in without it, but in today's day and age, it's an exception rather than a rule that you get in without USMLE or US match experience. If you cannot get a university rotation, or if you cannot afford a university rotation, then look for community rotations. They are usually relatively cheaper. For example, we work with a community rotation with Dr. Nasser, same again in San Diego, again with tele and in person. It's available for $1,000. So that's relatively easier. You
Yep.
can get that. And then again, telerotations have made things easier. So you don't have an excuse that I couldn't get a visa. Always you can do a telerotation. So that is what my 2 cents are about it. Yeah.
Well, thank you very much. And Aarti, if you can post Dr. Yasir Rasheed's all rotations link so that
Very
students
much.
can see all the rotations, and if they have questions, they can always reach out to us. But thank you, Dr. Yasir. Appreciate your time today.
Always. Thank you very much. Take care.
Thank you. So Aarti, as you are posting these links, I think I'll take questions meanwhile. So next up is student Michael, who's been, I guess, waiting very, very patiently. Michael, are you still there?
Yes.
Okay. Yeah. Thank you for your patience. I think you were the
Thank
first to
you.
join, but appreciate your time. So why don't you introduce yourself, and then we'll go over some of your tips.
Okay. Hello, everyone. My name is Mikhail Apinyan. I am MD physician from Armenia. Now I'm working at Medicine du Monde, France. In English, it Doctors of the World. And first of all, I would like to say thank you to the organizers of this workshop for the great opportunity to share our and to know about others' experience.
Okay.
Thank you.
So that's great. Thank you, Michelle. Now let's talk about something. Why did you choose telerotations?
Okay, among other important things, US clinical experience is very important for the IMGs to have stand-up application for the residency programs. And rotations are a good opportunity to have that. And after applying in-person rotation and getting invitation, I applied for US visa. But unfortunately, I did not get the visa, and that's why I applied for telerotation.
Yeah. And how do you think these telerotations, what were the challenges? Like you said, visa was a challenge.
Yeah. And not getting a US visa was one of the challenges that I faced during my USMLE journey. And the telerotation is a great solution in such cases. Telerotation helped me very much in the case of not getting visa.
Okay. And how was, so which telerotation did you do, and how was that useful?
going ahead, I would like to talk about the benefits that I get from and the advantages of the telerotation. So the benefits are get acquainted with the way of working in the US hospitals. Get very useful and important information about the diagnosis and the treatment of the different patients. And that was very memorable because we were discussing real patients with real lab values and exam results. Next one is get up-to-date information about recent researches and new guidelines for the diagnosis and the treatment of the patients. And get a letter of recommendations for which are very important for the residency application process. And finally, that was pleasure to work with Dr. Atut and with Dr. Weissman.
Yeah.
Moving to the advantages of the telerotation, firstly, I want to say that it is cheaper because, for example, there is no ticket and accommodation fees. Nextly, you can participate without a US visa and without leaving your own country. And finally, you can tailor it with your work.
Yeah. Well, thank you, Michael. Is there any other tip that we missed?
Okay, I would like to add that earlier I thought that the telerotation is second option after in-person rotation. But now, considering what I said above, I think that the telerotation is a great option, and even in case of having a US visa. And finishing up my speech, I would like to say thank you to Dr. Atut and Dr. Weissman for their kindness and patience, and for the knowledge which I get, and for the great time which I have during the telerotation.
Okay. Well, thank you very much, Michael, joining
Thank
us on
you.
this holiday weekend. Thank you for sharing your experience and your tips with us. Thank you.
Thank you too.
All right, like we move on now, I think Ashima from our team will be presenting, but I did want to take some questions meanwhile. So let me go over some questions as she gets ready. So one question is, I did MBBS in 2020, graduated with MPH as well from Yale, applying in March 2026. I've worked in research, but no co-authorship. I have no observership, so you definitely need hands-on, right? How do I approach for LOR? So there is a research course with us that offers LOR. You do have to do hands-on. So with your YOG, 5+ years, observerships will not help you. And it has to be so there is a gap, but you can overcome it by doing hands-on experiences, and Aarti can send you the link for the research course which has LORs. The other question someone is asking, how many US LORs are needed? I think minimum 3, but 4. Each program can accept up to 4. It is not necessary to upload home country LOR unless you are a very recent graduate and you're a gold medalist and they actually ask you for this kind of an LOR. You don't have to. All right. Okay, so someone has a question, Aarti, which you can check. Rotation starting in February 2025. They sent an email to enroll at USMLESarthi, and they haven't received a reply. So it may be, just the holiday. But so Aarti, if you can get in touch with this student, and if you can give us your full name and email, so Aarti will be in touch. So YOG 2001, it's an old YOG, but definitely we have students who have matched with 20-year plus YOG. So it's not that you cannot match. We'll have to look at it separately in terms of what your scores are, what you've been working with. Absolutely, we have 20 plus years of YOG match. So that's not a problem. LORs only for MBBS or MPH LOR works also. So it depends on your profile. Clinical LORs really help. So if you've done an MPH, I think that would mean your MBBS was slightly older. So hands-on LOR from US will work. Okay. All right. So now let's move on. So Ashima, are you there?
Yes, sir, I'm here.
Okay, so Ashima is going to talk about, for those of you who are interested in learning more about our collaboration, especially around step 1 exams. So we have 3 separate kind of opportunities for you. So Ashima, if you can just share your screen and get started.
Sure. First, I would like to say thank you to everyone who joined and stayed so far with us. Let's get started with this step prep. This is our website, and you can find all the details under the USMLE prep courses. First, let's take a look at USMLE mentorship program. Our first program is the USMLE mentorship program, which is designed for students who need structure, guidance, and expert advice to navigate their preparation. You'll start off with customized study plan tailored to your strength, weakness, and schedule. You'll have direct access to USMLE certified physician, Dr. Aditi Sen, who has done her residency in IM, but also her so
You've
she
done a
is
fellowship in
fellowship
nephrology.
in nephrology.
Yep.
So she is our mentor. We have 3 packages available with us. With her, there's a 60-minute session, 3-hour session, and a 5-hour session, which is coming up.
So I
Next.
think the idea behind this session is anyone who needs to plan their exams and all that. So first you set up time with Ashima. Ashima will review your profile and then guide you appropriately, and that's completely free. So Ashima, maybe Aarti, you can send the link, or I think there is a link at the bottom of this page also, right?
Yes,
So
you can scroll down and click here to contact. It'll take you to a page where you can schedule a one-on-one free strategy call with me, where I will review your profile and let you know which course suits you the best.
yeah. So after that, if you so need with Dr. Sen, who's very experienced, by the way, she did her research at Mayo, did her residency in New York, and then a fellowship, and now she's a practicing nephrologist. So she's the one who handles our step prep. So that's one. And the second exciting news is about our collaboration with AI-based tool, so Eminence AI, which you see on the screen. So I'll let Ashima give you a demo, and then we'll talk about how you can get involved.
Yeah, sure. So all you have to do is get started, and it shows you to a page where the AI brings up the introduction, and you can choose between rapid fire and QGen. So for now, we will click on rapid fire. This is where all the general topics are shown. You can pick any one of your interest or what you are planning to study. So if we do go for respiratory today, it takes a couple of seconds to pull out the question.
Yeah, it's but as we are waiting, so we have a collaboration now with Eminence AI, and the details should be out in a day or so. So we will, I think on their website they say $8 per month or something, but we will have very discounted prices for you. So here, there you go.
Okay, so it pulls out a question with 5 options. So you can choose according what is right. So if you decide that it is option B, it lets you know if the answer is incorrect or not. It gives you a second choice to take a shot at it. And if you go with another option, it'll let you know if it's correct or incorrect, and it'll let you know which is the correct option and an explanation. Once that is done, it moves so on and so forth to the next question. So
So
this is how.
I'm sorry. So the idea behind this is for those of you who are looking to prepare for USMLE, a very cheap and affordable way, and it's all AI driven. So it actually pulls the questions, and it's like I said, they are offering for $8, and our students, or if you go through Sarthi, be much cheaper as well. Yes. So these are all the questions that you will need. Wait a couple of days and we'll give you all explanation, but we just wanted to launch it. So UWorld and all other aspects, so they have collaboration with these organizations. So it's a very good prep tool on the go that you can use. So after this webinar, we'll send you an email, and then you can get enrolled. Like I said, very, very affordable. And this is, a very good upcoming company with the AI. Yes, it does have for CK as well. So it will help you prep for step 1 and CK in a very, very affordable manner. So
Right.
that's the second part. So Ashima, let's go to the Kaplan.
Yes, so this is our newest collaboration with Kaplan, where for step 1, you have the QBank available, the on-demand program, and the live online. To just summarize it, QBank, you just receive the access to the QBank and 2 full-length practice tests. In on-demand, you have the on-demand videos, you have question bank access, you get ebooks, as well as different kind of tests to keep assessing yourself. Live online has all the same features with 6 weeks of live classes with the US faculty, and you have a pass guarantee by Kaplan that helps you pass the exams. And if you do not, because of the material or any other reason, then they do offer a cashback as well. And if you're looking to go to New York and study at the center, we have that available as well. For step 2, we have the same options of on-demand, live online, and in-person. The in-person at the New York Center is 12 months for step 1 and 9 months for step 2.
Yeah.
And then we have question bank for step 3, on-demand for step 3, and the live online. So if you have any questions, you can always scroll down at the bottom of the web page. You find here a contact of my WhatsApp, my phone number, and as well as my email ID. And if you click on this link, it'll be taken to Calendly, where you can schedule a one-on-one strategy call with me, and I will take care of all your queries.
Yeah, the idea here is now we also have a collaboration with Kaplan, and the idea being that if you are preparing for steps, we'll assess and we'll guide you on what resources to use. So we are not saying blindly go for the AI tool or go for Kaplan or this or that. So that's where the mentorship with Dr. Aditi Sen can come in handy. You can First, you set up time with Ashima. Ashima looks at your profile. She'll tell you what she feels is right based on what you need. And then if you want, you can obviously go for a 60-minute session with Dr. Aditi Sen. Like I said, she's one of the most experienced ones. She's done her residency, her fellowship. She has gone through all of this. And then we can decide if your fundamentals need to be brushed up. So whether it's Kaplan or just the AI-driven Eminence tool as well. So we are launching this comprehensive end-to-end guidance for step prep also. So thank you, Ashima. All right. I think that was all that I had for the webinar today. Like I said, there are attractive discounts for platinums. For those of you interested in starting with the match plan, going into the match next season, there are discounts for rotations and research. There are free telerotations also available. But these discounts don't last very often, it's for that long. It's in December and January. So we are offering this as a getting started one. And I think someone is posting to host and panelists. So Aarti, look at the message. I think this is regarding some of the rotation. So anyway, so we have a lot of rotations and research discounts. If you are interested, send us an email and we'll help you get started. With that, if there are any other questions I can take, I'll be happy to take. And then, we can go from there. Any questions that I missed? Let me see if I missed any question. Is it important to do all clinical rotations as close as possible to the match season? Can I also do rotations during medical school? Well, the advantage of doing during medical school is they count as electives, which are very, very strong and useful. So if you can do electives, you can. So till when is the free rotation available with the platinum plan? So free rotation actually has a lot more flexibility. If you join platinum plan within the next week, then the free rotation you can do till July, August, September. So we are not saying you have to do it now, but the point is you have to join the platinum plan at this point. So within the next week. So then you can avail of the free rotation during this season. Okay. Is research included in the platinum plan? No, research is a separate course altogether, as you can see. However, if you enroll in platinum, like I said, Dr. Weissman is offering discounts on research, the IRR research. So at this point, all research is being discounted. There are very, very attractive discounts for research as well, but it is not part of the platinum plan. Platinum plan, we do tell you what research to do, how to look for maybe even full-time research position, which journals you can try and all of that. So the research strategy, we can definitely help in the platinum plan, but research per se is not included in the platinum. Do you suggest all 4 LORs from the US? Yes, definitely all 4 US LORs. Unless you got a 270 and you are a recent graduate, then probably 1 LOR from home country can work. Can research LOR count in one of those 4? A US research LOR can be counted in one of those 4, not any home country research LOR. But again, we'll have to look at your profile before we give you the right kind of an answer, Anything else that I can answer before we wrap up? Let's see if there is any other question. Is clinical LOR better than the research LOR? It depends. Again, depends on your profile. If you're targeting community programs, I would say all 4 clinical LORs are good. If you're targeting a university program and you have the profile, the scores, etc., then I think a research LOR definitely will help you as well. Can Dr. Aditi mentor for a hands-on clinical experience? I don't know the question. CE with Mayo. I don't understand the question that was asked. Okay, so actually, I think we have one of the speakers who've just joined. So you all are lucky. Dr. Jugalkishor has just joined, and maybe we were running a bit quicker. So Jugal, are you still there?
Yes, I am. Hello, sir. How are you?
Good, good. No, thank you. Thank you very much, Jugal, for joining.
Thank you very much for inviting me.
We were running early and I thought you were busy, but thank you for your time. So why don't I did give you access to the video, right?
The video?
I'll give it again. Yeah, you should be able to share your video.
Okay.
So So as we know, so Jugal, this is I think your camera needs to be a bit.
Anyway,
Yes.
now
So
it's
thank you.
better.
So Jugal, why don't you introduce yourself and then we can go over the questions or the tips that you have.
Of course. So my name is Jugalkishor Chauhan. I graduated from GCS Medical College, Ahmedabad, and I have been teaching a lot of medical students after my graduation. I have been teaching a lot of students at ND Desai Medical College, Nadiad, since the past 2 years. So I have some extensive experience in teaching, and I'm also teaching. I've also taught a lot of students online about USMLE steps 1 and 2. I have applied this year for internal medicine, and I'm currently going through interviews right now.
So how much of your US LORs were all specialty specific, or were they in different specialties?
I would say my LORs were mostly half of them were internal medicine, which I wanted to start my career with, and half of them were specialty specific. And these are the specialties that I think that I might want to go to in future. So it's always good to have some specialty specific LORs, but not all of them. So that's what I think.
So let me just clarify. So when you say in future, you mean a subspecialty LOR. So IM, maybe cardiology, maybe GI, right?
Yes. So mine were cardiology, hem-onc, and infectious disease.
But nothing in FM or any other specialty, right? They were all IM or IM subspecialties.
Yes, all IM or IM subspecialties.
Okay. Okay. And what are some of the most common mistakes you have seen that students make as maybe they are approaching physicians for LORs, or then they say, I didn't get a strong LOR. What are these mistakes that you've seen?
I would say first of all, you cannot just straight out ask the physician for LOR without even building a rapport. So you have to be building a rapport with that physician if you want him to be encouraged enough to write you an LOR and give you a recommendation. He's giving out his recommendation, and doctors in US usually think this way, that if I'm giving out my recommendation to this particular student, right, my recommendation has some value. So you have to prove it to him or her that you're worthy of his or her recommendation. So you have to be good at your clinical skills. You have to show that first, and after you've built that rapport, right? After that, you should be able to ask the physician that would you please give me a letter of recommendation. So yeah, a lot of people do it too early. I would say don't do it early. Wait for at least 3 weeks.
Yeah. So Jugal, you've been through this journey now, and you have extensive experience. What are your tips overall when it comes to US clinical experience? What should the students focus on? What are absolute no-nos? Any general tips that can help?
Well, I have been through the whole thing, and I would say the most important thing that in the whole USMLE journey is doing everything early. I would say that's the most important thing. So if you're planning on, let me tell you what I think, right? So let me tell you, I think that if you want to go to a particular hospital in future, like if you think that you have the ability to get that kind of a score, that kind of a hospital that accepts IMGs, you have to research all of that while you are going through your USMLE journey, right? And if you do that, you might find a lot of hospitals, community hospitals, a lot of university hospitals, which are expecting international medical graduates. And now, based on that information, you can actually apply there for rotations. So you can start early as applying at a hospital which accepts you as a resident. So you might even have to start like a year, 2 year early researching which hospital you want to go to as a resident. So that's why I think doing everything early is the most important thing when it comes to USMLE journey.
Okay. And what are the other common mistakes that you've seen students do, whether it is patient interaction, whether it is, inability to understand the US healthcare system, but what are the common mistakes that you've seen?
Well, during my clinical experience, I've seen that, well, patients here are very interactive. So patients here are here for some socializing, here for talking about different things, right? So in India, we don't usually do that. But here, it's very common to interact with a patient, right? And like a friend, actually, right? And ask them about all the problems that they have been having. And that's actually considered polite here. So people don't do that, and people just stick to their notes, and that whole thing becomes very machinic, I would say. So if you want to be a better clinician, this is something that I learned from a doctor at Cleveland Clinic. He said, if you want to be a better physician, you have to be a better human first. So yeah, so that's what matters. So that's a mistake that people do make. Another mistake I would say is that well, when we are well, there are boundaries, right, when it comes to patient care. So you should know all the ethics and all the ins and out of ethical ideas of US healthcare before you come here. So if you are done with your step one and done with your ethics part, that's a really big help. So I would say that's the other part, that you should be able to know all the ethical ideas of US healthcare system. And yeah, I think those two come to mind immediately.
Yeah. Well, thank you very much, Jugal. Anything
course.
else that we missed? Anything at all that you think is important that you want to bring out?
Well, I would say everyone here is going through their journey. Everyone here should be encouraged, right? And I know the path is long, the path is heavy, but you have to start somewhere. You have to uh, build the foundation of a building before you see the whole building. So, of course, I mean, so just work on your foundation, I would say, right? So, work on your step one. Step one is pass fail now, but step one is extremely important to get you through step two, right? I mean, my step two preparation was not that very good, but because of my step one preparation, I got a better score in step two. So just work on your step one. It is like, it's religiously. I mean, work on your step one the most, I would say, from the beginning when you're young. So yeah, that's something that I would like to add and give out to all the students. Thank you so much.
Well, thank you, everyone, and thank you, Jugal.
Thank you.
I appreciate
Thank you,
your
Dr.
time
Thank you, Mr. K.
this
Of course.
weekend.
It's a pleasure.
Thank you. All right. With that, I think we are coming to the end of this webinar. And if there are any other questions, you can always email us, and we'll take it from there. And of course, you have our links, our webpage, contact us information. So anything that is not covered, let us know, and we'll get to it. Thank you all. Hopefully, this was a useful webinar, and we'll see you next time. Thank you, everyone. Thank you, Jugal.
Yeah, of course.
Bye.
Bye.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.